We've come to the pelvic girdle, which is part of the appendicular skeleton that attaches the lower limb to the axial skeleton. So, our pelvic girdle actually consists of two bones, the right and the left coxal bones. So, we have two coxal bones. So, posteriorly, which would be in the back, dorsal, they connect to the sacrum. So we have a joint here, which is actually called the sacroiliac joint. So you might have heard of this joint because it is commonly inflamed and causes pains and issue with people when their pelvis is out of alignment, and it is called the SI joint. So if we look at an image of this, we can see here we have the sacrum. This is one coxal bone and one coxal bone on each side. So you notice that there is a joint here. You'll also notice that anteriorly, they connect with one another at the pubic symphysis. So we can say anteriorly, they connect at a type of cartilaginous joint, the pubic symphysis. Okay, so we have this diagram that shows that pubic symphysis right here. Now, normally the pubic symphysis and the pelvis is pretty rigid. However, I have to mention that during childbirth and late stages of pregnancy, there's a hormone called relaxin, which loosens up the pelvis. And that is all in preparation for childbirth in females. We'll also note that each coxal bone is actually three separate bones that then fuse in the adult. So we can't actually see that they're three separate bones on this diagram right here. They have them color-coded, but if you were just to have a coxal bone in your hand, you wouldn't be able to see them. But they are separate, and that allows for the pelvis to change shape as the child grows. And so the three bones that make up the coxal bone, so we could talk about the coxal bone. We have the ilium. So if you were to place your hands on your hips, that would be probably the iliac crest. So that is shown up here. We also have the ischium down here. So we have the ischium, C-H-I-U-M, and this is where you sit. So this is the ischial tuberosities. When we look at the pubic bone, this would be the pubis, so the pubis. So here we see the three bones that make up the coxal bone. Now, some other things to note is that we have what is called a pelvic brim. These are things you don't need to know, but this brim, and this separates the true pelvis above and the false pelvis below. So this brim and the shape of it is really important, and we can see the differences in males and females because of the female's ability or the need possibly to have the fetus's head move out through that opening of the pelvic brim. We also have the sacrum here, and then we have the tailbone that kind of goes underneath. And so those will be structures that will also be different in males and females. Now, some things that you might have questions about, so you don't need to know these, but the obturator foramen is a hole through which nerves and blood vessels and other things come out and go to the lower limb. So in a living person, they are not a hole, but that obturator foramen just kind of looks interesting on a pelvis. We can also see that we have these indentations here, which we're going to talk about in the next lecture, which are the acetabulum. And this is where the femur is going to connect into the pelvis. And this is going to make up the hip joint, which is a ball and socket joint. So if we look at the differences between male and female pelvises, you'll notice that the male pelvis in this particular instance looks narrower. And when we're like, if we're looking at forensic anthropology and we were trying to figure out whether an old skeleton was a male or female, we might look at some of these characteristics. So the pubic arch is very narrow, that's less than 90 degrees. The pubic arch on the female is bigger. We have different shaped obturator foramens. The acetabulum is wider, so that's an issue with females, as having that wide pelvis takes the acetabulum out and maybe at a slightly different angle. But this pelvic inlet's a big difference. In the males, it's said to be more heart-shaped, and in the females, it's said to be more oval. And again, all of this has to do with the need to give birth. So those are the differences between the male and the female pelvis.